Alzheimer's disease is a brain disorder that affects millions of people worldwide. It is a progressive condition, meaning it gradually worsens over time. The disease primarily impacts older adults, but it is not a normal part of aging. It slowly destroys memory and thinking skills, making it difficult for individuals to recall recent events or recognize familiar faces. This cognitive decline can be distressing for both the person affected and their loved ones. This makes it hard to do everyday tasks, such as cooking, managing finances, or even dressing. Over time, individuals may require more assistance with these activities, leading to increased dependence on caregivers. Imagine a library where books are constantly being misplaced and shelves rearranged. This analogy helps illustrate the confusion and disorganization that occurs in the brain of someone with Alzheimer's. That's what happens in the brain with Alzheimer's. Connections between neurons are lost and information becomes difficult to retrieve. This disruption in communication between brain cells is a hallmark of the disease. As the disease progresses, brain cells die, leading to a further decline in cognitive abilities. This cell death is irreversible and contributes to the worsening symptoms. This leads to more severe memory loss and changes in behavior such as increased confusion, agitation, and even personality changes. These symptoms can be challenging for caregivers to manage. The disease is progressive, meaning it gets worse over time. Early symptoms might be mild, but as the disease advances, the impact on daily life becomes more pronounced. It's the most common form of dementia, a general term for memory loss and cognitive decline. Dementia affects millions of people globally, and Alzheimer's accounts for 60 to 80% of all dementia cases. Early signs of Alzheimer's can be subtle. Often it starts with forgetting recent conversations or events. Difficulty finding words, misplacing things, or getting lost in familiar places are other common indicators. As the disease advances, symptoms become more pronounced. Individuals might have trouble remembering names of loved ones or experience changes in personality and mood. They may need help with basic activities like dressing or bathing. While the exact causes of Alzheimer's are not fully understood, scientists believe a combination of factors is involved. These factors range from genetic predispositions to environmental influences and lifestyle choices. Research is ongoing to pinpoint the exact mechanisms that trigger the disease, but it is clear that multiple elements contribute to its development. Age is a significant risk factor, with the likelihood of developing the disease increasing after age 65. As people age, the brain undergoes changes that may make it more susceptible to Alzheimer's. However, it's important to note that Alzheimer's is not a normal part of aging, and many people live well into their 90s and beyond without ever developing the disease. Genetics also play a role, particularly in early onset Alzheimer's, which affects individuals under 65. Specific genes have been identified that increase the risk of developing Alzheimer's, and genetic testing can sometimes predict the likelihood of the disease. However, having these genes does not guarantee that a person will develop Alzheimer's, indicating that other factors are also at play. Other risk factors include lifestyle choices, cardiovascular health, and head injuries. Poor cardiovascular health can lead to conditions like hypertension and diabetes, which are linked to a higher risk of Alzheimer's. Additionally, traumatic brain injuries, especially repeated ones, have been shown to increase the likelihood of developing the disease later in life. Research suggests that maintaining a healthy diet, exercising regularly, and engaging in mentally stimulating activities may help reduce the risk. Activities such as reading, playing games, and learning new skills can keep the brain active and potentially delay the onset of symptoms. A balanced diet rich in fruits, vegetables, and whole grains, along with regular physical activity, supports overall brain health and may offer protective benefits against Alzheimer's. Section 4. The impact on daily living. Alzheimer's disease profoundly impacts daily life, not only for the individual but also for their families and caregivers. As the disease progresses, simple tasks like cooking, driving, and managing finances become challenging and eventually impossible. The emotional toll can be heavy as well. Individuals may experience frustration, anxiety, and depression as they grapple with their declining abilities. Caregivers often face immense stress and emotional strain as they navigate the demands of providing care. Section 5. Current approaches to treatment. Currently, there is no cure for Alzheimer's disease. However, there are treatments available that can help manage symptoms and improve quality of life. Medications can temporarily improve memory, thinking, and language skills in some individuals. Non-drug approaches, such as occupational therapy and support groups, can also be beneficial. These therapies focus on helping individuals maintain their independence, cope with behavioral changes, and enhance communication skills. Section 6. Hope on the Horizon Advancements in Research. While Alzheimer's remains a complex and challenging disease, there is growing hope for the future. Researchers around the world are dedicating their efforts to unraveling the mysteries of this condition. Scientists are making significant strides in understanding the disease mechanisms and developing new treatments. Through collaborative efforts, they are piecing together the complex puzzle of Alzheimer's, one discovery at a time. Research is ongoing in various areas, including developing drugs that target the underlying causes of the disease, exploring gene therapy, and investigating the role of lifestyle factors. Scientists are also identifying early biomarkers for diagnosis, which could lead to earlier and more accurate detection of Alzheimer's. This early detection is crucial for effective intervention and treatment. These advancements offer hope that one day we may be able to prevent, slow down, or even cure Alzheimer's disease. The dedication and passion of the scientific community are paving the way for a brighter future for those affected by this devastating condition.